There are some people who are lucky enough who either don't have symptoms or the symptoms have come on so gradual they don't even know. So a good analogy is like a factory full of light bulbs, and you just turn off one light bulb a year. Well, in 10 years, you probably don't notice how dim it is. But you put
Mm,
all those light bulbs in, and wow, you feel like a
mm.
totally different person, and you didn't even realize that your hormones was low.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Leesa Ennenbach, who is a Bachelor's of Science in Nursing. She has 27 years experience as an RN with 15 years experience in the bioidentical hormone health and preventative care space. Her career started as a neonatal intensive care and ICU nurse. Anew, which is her practice, life helps men and women optimize their hormones to live their healthiest life, symptom-free of declining hormones and age-related disease past age 35. She started in 2011 with one clinic and quickly grew to 3 states, Kentucky, Indiana, and Ohio, with 7 clinics by 2015. At that time, she also added a pharmacy to service her members. The company has been nominated numerous times for the Fastest 50 Award, fastest growing companies in Louisville. So, Leesa, welcome and glad to have you here on the show.
Thanks for having me, Daniel. Boy, that makes me tired. You just saying all that.
I know it was one heck of an introduction.
Done
So,
a lot in 14 years.
I know. So, I'm curious. Let's start here. How did you first get interested in medicine?
To be honest, I was in school. I graduated a year early from high school, and I didn't really know what I was going to do. My roommate came home and said, I'm going to nursing school. I literally said, sounds good. I'll always have a job. I may not be rich. I mean, that's how it happened, but it worked out perfectly. I got into nursing. I decided to do the neonatal intensive care. Unfortunately, after my second child was born, my mother passed of ovarian cancer at the age of 54. So I knew if I was going to get back into medicine, I wanted to get into preventative type care, and that's exactly what I did. So I not only got into it, I started a business. My husband and I own the business together. He is the entrepreneur of the marriage, and I am the medical side of the marriage.
Mm.
And bioidentical hormone health is, with all the research that it has behind it, is what we know prevents age-related diseases, keeps you healthy and symptom-free. Most people come to us because they have symptoms. But really, we try to explain to them and teach them the reason that you want to do bioidentical hormones is because it prevents those age-related diseases such as cancer, osteoporosis, Alzheimer's, high blood pressure, diabetes, heart disease. All those things that you see normally when people age is what bioidentical hormones can prevent.
Okay. So when it comes to the bioidentical hormones, just so we can kind of make it simple for people who don't quite understand what hormone replacement therapy is or any type of these treatments. Now, people I think understand that they have hormones, but when it comes to hormone replacement therapy and these types of treatments, what exactly is it? Is it trying to figure out how to get you to your optimal level of hormones, like based on who you are, or what exactly is what is it?
So great question, Daniel, and I love that you use the word optimal. So if you're looking at some lab results, if you're a certain age, the levels will range. We have a tagline. If you're 35, you probably need us. If you're over 40, you definitely do. Your hormones start to decline around that age. And the most important thing to do is replace them bioidentically. That means we match molecule for what your body made. And that's really important because synthetic hormones in the studies have shown that those can cause cancers. So we're very careful to make sure that we do bioidentical. So we're obviously preventing the disease and not causing the disease. So again, that's just matching molecule for what your body made. Your body's not going to reject it, and your levels are going to be optimal. For instance, testosterone in men, the range is 200 to 900. Now, you're going to tell me that a man at 200 feels like a man at 900. So for us, optimal is more around the 8 to 900 range. And there's really no reason why we can't even get a little bit above that. We also go by symptoms too, as well, because sometimes those ranges can vary depending on the time of the day that you have your labs drawn. So again, we want the patient to feel good. We want them to be safe. And, we want to prevent those diseases and the symptoms. People come in, they're tired. Their sex drive is not there. Their energy levels are low. Their metabolism is off. hot flashes for women. Men can actually have them as well. All these symptoms that you see go along with low hormones. And if you replace them, those symptoms will go away, and you're also preventing the diseases as well.
Okay.
Does that make sense?
Yeah, it does. Now, I've heard that when it came to hormone treatment, kind of one of the big myths out there and one of the big fears out there is that people think, oh, if I get hormone treatment, I'm going to get cancer, which my understanding is it came from a very big study that was actually very flawed. And so that's
Yes.
where they came out of, and you kind of prompted this because you talked about synthetic. Even then, it was because it was synthetic hormones, not the bioidentical ones. But my understanding was that they just like pumped people like with a ton of hormones, like more than you would have ever imagined that you'd ever need.
Well, the study that you're referring to is the Women's Health Initiative in 2002. And that's really, really important because they're actually calling it now one of the worst medical mistakes that they've made. Because women did become, in particular, women very scared of estrogen. And estrogen is a very, very protective hormone. It protects the brain, it protects the heart. What's the number one killer of women? Heart disease. So if you give back the estrogen, then you're going to decrease that, but you have to do it safely. So in that study, they used basically horse urine. It was synthetic estrogen, and they used a synthetic progestin, not your micronized progesterone. So literally overnight, it went from the prescriptions went down from 20% down to 4%. Women just throw it out, flush it down the toilet, whatever. They were scared of it. Doctors stopped learning about it. Basically, they get, if anything at all, Daniel, they get 1 hour of hormone health in med school, and they become uninterested in it because they thought it was bad. So
Yeah.
now, when we look back, we actually realize, wait a minute, that study was flawed. There was actually not a decrease. There was actually an increase in the prevention of the diseases that we're talking about, and not a decrease. So we did a lot of harm actually with that study. I'm just really glad that it's out now, because even in 2011, we were battling a lot of those fears. And now with social media and the way things are, we're able to say, hey, we're not the only ones. The studies are there. We haven't been just making this stuff up, but it was really hard and still is sometimes. Sometimes we really have to explain that to people. That's why I love the education part of it. My biggest job is to educate women and men on hormone health. And if I can do that, because they're coming to me, like I said, for symptoms. Of course, we're going to get rid of the symptoms, but let me educate you. Even if you're not having symptoms, Daniel, it's not healthy. When your hormones decline to a certain point, there are some people who are lucky enough who either don't have symptoms, or the symptoms have come on so gradual they don't even know. So a good analogy is like a factory full of light bulbs, and you just turn off one light bulb a year. Well, in 10 years, you probably don't notice how dim it is. But you put all those light bulbs in, and wow, you feel like a totally different person, and you didn't even realize that your hormones were low, excuse me.
That's a great example. I would have never thought of it that way, but it makes it so clear that, okay, that's why it makes sense. Like, you want to look into this. Now, I did
Yeah.
want to ask one question. So you're talking about the synthetic versus the bioidentical hormones. Synthetic, you mentioned, was basically came from horse urine.
Yeah,
But
some of them. Yeah.
what makes the bioidentical? Like, is it coming from a person? Like what makes it different
No,
from
so basically
synthetic?
it's plant-based. It's like a yam,
Mm,
and it's produced in the lab, and it makes sure that I'm not a scientist, but it makes sure that the molecules are matched molecule for what your body made. So that's the difference.
okay, got it. And now I want to go back to the symptoms, because you mentioned that in some situations, and you mentioned this earlier, like some symptoms would be, I think, like hot flashes for women or low sex drive. I've heard even like bad sleep could be the cause of
Mhm.
hormone imbalances. But you mentioned people that don't have symptoms that could still be suffering from this. So how would people know? Or is it something that almost like your annual checkup with your doctor, you should just get this checked just so that you know and you're aware, do you need hormone treatment or not?
Well, I'm glad you brought that up, because again, if you go, first of all, studies show you get 5 minutes with your primary care provider. So A, they don't really have time. And B, if you're not coming to them with something wrong or a symptom, they're going to look at those ranges. And if a gentleman is 250, like I said, or 300, and still complaining of low sex drive, or his workouts not being good, or his metabolism not being good, they're going to say, yeah, but you're okay. So it's kind of like you wouldn't go to a plumber to fix your electric. So this a primary care, it's not their fault. We've treated over 35,000 people. Some of them are doctors. And I can remember being in some consults and say, well, you're a physician. And he or she would say, no, I don't know. That's why I'm here. So really, they need the education too. They're seeing 60 or 70 people a day. And in our case, we're seeing 7 or 8 people a day. So we have the time to really dig into, what's going on, what's the cause. There's times that we found cancers, before people have even started. And there was a gentleman, he was in his 40s. This was probably 8 years ago. And he was not going to go to his primary care. He was coming to us because he was having some of the low testosterone symptoms. And his PSA, which is a test for the prostate, was already elevated. And there was no real reason for him to go to the doctor other than some of the symptoms that we mentioned. And basically, he got treatment and was able, for that, and was able to come back and get hormones. Because even after you've had cancer, in some cases, we are allowed to treat. So he wrote us a letter saying, you saved my life. I have young children. I would have never got to see them grow up. I probably never would have went to the doctor because I felt fine other than my sex drive was low, some of the things that we had mentioned on TV. So it is important to go to experts, people that know what they're doing. Otherwise, they're going to look at those ranges and they're going to be like, oh, you're fine. Yeah, but you're not optimal. And optimal is healthy.
Okay. So with the optimal range for men in particular, you're mentioning it's anywhere from 200 to 900, but 200, you're really like, it's okay, but it's not, it's really not.
Right. That's normal. So
okay.
optimal, we strive. Usually it's like right at the high end. Sometimes it could be a little bit over, like in the case of thyroid, and that's a whole different story. Depends on the person, depends on the symptoms. But generally, it is at the highest level. There is one hormone slash vitamin, which is vitamin D, where we like it to be a little bit lower because that one could be toxic. So there's a lot more to it than just, oh, you're at this range, you're good, you're not good. You have to really know what you're doing. So you should go to an expert.
Okay. And so for testosterone in men, is it kind of like a more is better kind of thing? Or is it like you should just be at the higher end of this range?
Some men, so 200 to 900, like I said, is within normal limits.
Mm-hmm.
Most men at 200 are going to feel really crappy.
Mm-hmm.
I won't use bad words.
Yeah.
Really bad. Some men will get them to 500 or 600 and they feel great. We don't necessarily have to get them to 800 or 900. There's also something called free testosterone versus total. Free testosterone is what is freed up in the body and you can utilize it, and total is just the total. So sometimes all the time, we always look at that number to make sure the free is also in the optimal level, which is about 30 to 40. Sometimes we can get a man to say 900, but their free is still below. So we may have to go past that 900 to make them, and it's also symptoms too. Are you still having symptoms? If so, we can treat a little bit more. It's not like we're going to try to take you from 0 to 900 just like that. We want, and everybody's different. You may get testosterone and it absorbs quickly and your range is perfect, or we have to play with it for a little bit. Men are much simpler to treat than women. I will say that. We have 3 major hormones that we have to treat, but we do 4 pages of labs to make sure you're a good, healthy candidate. And then we play with those numbers based on your absorption. There's different ways to give testosterone. So there's a lot of factors.
Okay. And so for the testosterone, you're talking about the total and the free. So is really the free testosterone, I guess, the underlying one that you really need to look at? It's just a matter of adjusting the total to get you there?
Yes,
Okay.
usually the total and the free go hand in hand, but if it doesn't, we have to look at other things such as DHEA, which is a precursor. Sometimes that can help raise the free testosterone if the total testosterone comes up, but the free doesn't. So we have tools in our toolbox, so to speak, if those numbers don't go up hand in hand. Generally they will, but if they don't, we have to dive a little deeper and look at some other numbers.
Okay. Now, testosterone for women, because I think I heard this before that sometimes women need to get that testosterone also, and that's important. But I think that most people don't think that, oh, you're a woman, you don't need testosterone. That's for guys. So do women need testosterone? And if so, like, what does that process look like?
Yes, women actually do. Like I said, testosterone, the number one killer of women is heart disease. And what are we the lowest in past age 35 or 40? Testosterone. Most of the time I see a patient, they're in the basement, so to speak. They're zero. They don't have any total or free. So we definitely want to give that back. Our range is around 100 to 200 total and 3 to 5 for women. So we're not trying to, turn women into the male species here, but we want them to be at what they used to have when they were younger. So it is very important. A lot of women think that testosterone is just a male hormone, and a lot of men think that estrogen, generally give men estrogen, but I will tell you this, Daniel, it's healthy. Testosterone converts to estrogen when we give it to men,
Hmm.
and that's actually healthy. So
Hmm.
if they're not having side effects from high estrogen as a male, breast tenderness, erectile dysfunction, things like that, we're actually going to keep that estrogen high. There's also a blocker. If the estrogen gets high, sometimes it'll happen if men have some belly fat or some other diabetes, some other factors going on. We can block it. But if they're not having symptoms, we actually leave it alone because it's actually a healthy hormone for men as well. So a lot of
Interesting.
the hormones go hand in hand for men and
Yeah.
women. People just don't
Okay.
realize.
Yeah, that's really good to know because I think most people think about men, testosterone, women, estrogen, and like that's it. Like as a man, you
And
don't
that's
want
it. Yeah.
estrogen, and women, you don't want testosterone. But it's good to know
Yeah.
both need it just at different levels, but it's still important for
Right.
both. Okay, now I want to switch over to the women's health side because you mentioned there's three hormones. We know estrogen is one of them. What are the other hormones, and are you kind of treating it the same way with the testosterone in men? Like you're looking at the different levels, you're trying to find the optimal levels for all three of those?
Absolutely. So in women, the three major ones are testosterone, estrogen, and progesterone. Now, mind you, we're looking at 4 pages of labs before we get started with anything to make sure they're a good, healthy candidate. We're looking at a complete blood count. We're looking at a CMP, which is like your liver. We're looking at electrolytes. We're looking at magnesium. We're looking at DHEA. We're looking at vitamin D. We're looking at all these things. But in women, the main things to get optimal, and optimal can be a little bit different. We know what we like for women to be at about, and but sometimes they go a little over, they feel better, sometimes a little under. Everybody's different. Keep in mind the lab test, depending on the time of the day, time of the month for women, can also be skewed. So a lot of times you have to listen to your patient. Well, I'm still having hot flashes, and we're not going to go, oh, well, your estrogen's perfect, so we're not going to give you any more. We're going to listen to the patient as long as it's being safe. Actually, a menopausal woman is the easiest to treat because she has lost her estrogen. When you hit menopause, there's a lab test called FSH. And if you're still cycling, like for in my case, I had an ablation, so I didn't know for sure because I didn't cycle. But if you don't cycle for 12 months and your FSH is above 50, then you're in menopause, which means you're not making any estrogenol, which is not healthy. We like that level to be 60 to 80, maybe a little above that, but I can give that to you. If you're premenopause, which is called our perimenopause, that's the most difficult to treat because we don't give you estrogen yet unless it's significantly low on every test that we take, and we test it very often. And here's why. Because when you're cycling, this is what estrogen does. We don't want to put estrogen on top of estrogen when it's up here sometimes of the month.
Mhm.
So to combat that, we give you progesterone, and that one kind of helps when the estrogen gets high to kind of offset any of those symptoms or things that you're feeling with too high of estrogen, if that makes sense.
Okay, interesting. So I guess how often would someone need to kind of be aware of their hormone levels? Is it something that you're doing like on a daily basis, a weekly basis, a monthly basis? Like with your point you brought up, it's like, oh, if estrogen is high, you want the progesterone to kind of balance that out. But maybe sometimes of the month estrogen is really low, so you need estrogen to bring that back up. So how does someone kind of keep track of that, like when they need which hormone?
So we always do an initial labs, and we look at them, and we have something that's called a story, and we plug it in, and it kind of goes through everything. And we basically guess at what they need, I'll be honest, but for the most part, it's a range of what we give to start with.
Mhm.
And then 30 days after that, we get labs. Okay. So let's say I give a woman progesterone and it just goes through the roof. Obviously, I need to decrease that. And she's probably going to be a little sleepy. Things are probably going to go hand in hand, but unless it's a dangerous level for some reason, which really we can't really get dangerous levels, then you're going to listen to your patient. Oh no, don't take that down. I feel great. I'm sleeping.
Mhm.
I'm not sleepy the next day. Progesterone is the anti-anxiety, antidepressant. It actually got me off my antidepressants that I had to go on after my mom passed.
Mhm.
I had situational depression. I kept telling my doctor, I'm not depressed. I just, have anxiety, which I've had my whole life.
Mhm.
And they just kept saying, no, you need this Lexapro, whatever it was. My body didn't make Lexapro. My body made progesterone. So
Mhm.
once my levels got optimal, then I was able to come off of that. So it's kind of a trial and error, and
Mhm.
you listen to your patient as long as we're both being safe. And obviously, we're going to stay in our safe zone.
Got it. Okay. Now, I want to bring up this concept as far as because you mentioned how this could really turn people's lives around, but also marriages. I want to talk about how this is actually able to help save marriages as well, because I'm sure that husband and wife, they maybe get on each other's nerves, and then they the stress and
No.
anxiety in the relationship. Yeah, no, can't be just everyone, only a few. But so how does this treatment help save marriages?
So we love it when couples come in together because let's face it, when couples are married for a very long time, the obviously, like I said, 35 and above, your hormones start to go down. 40 and above, they definitely go down. So the sex drive is going down. And if we have a male come in and his sex drive is great and his wife's sitting at home and hers isn't, then she's probably hopefully going to follow. And again, it's usually a symptoms. But then when she comes in and we explain everything and her sex drive goes up, what happens? They have more of a healthy, I mean, sexual relationship in a marriage, we all know studies have showed can be very healthy or is very healthy. So especially when the woman comes first and the male can't keep up, then he's usually running in as fast as he can. So we've had a lot of couples come in and say, look, you saved our marriage. I mean, we were sleeping in separate bedrooms. We just felt like we didn't have a connection anymore. And it's not just about sex drive, but you want to look good. You want, and that sometimes give you the motivation. A lot of times people come in and they'll want to lose weight. And we do weight loss as well, of course. And I'll say, unless they just really want to get to it and they have a lot to lose, sometimes the hormones alone can actually, especially thyroid, increase the motivation, increase the metabolism, and you don't need the weight loss drugs. So that's important too. Everybody wants to look good. Everybody wants to feel good. And that's what we're trying to do from the inside out. We added aesthetics a couple years ago, but we don't have to talk about that. But yeah, as far as relationships goes, I do feel like, couples want to look good for each other and they want to have a healthy marriage and they want to have a healthy sex life. And that's hard to do if you just aren't in the mood all the time.
Yeah.
So
So where do people get started with this? Because you mentioned like if they're around 35, they probably need you. If they're over 40, then they definitely need you. So if someone's around 35, should they just get tests done and kind of see where their numbers are? Or like what's the first place someone should start with this?
So the first place would be lab work. And, we're seeing even younger and younger ages, especially thyroid and testosterone go down. But typically, like if a female is still wanting to have children, we won't mess with testosterone or anything. We could give her a little thyroid. So we have junior memberships as well that don't incorporate all of the hormones. But 35 and above, I would suggest getting a baseline, especially at 40, and just seeing where your levels are. We spend 1 to 2 hours with you on that initial assessment, which is important. Like I said, studies show you get 5 minutes in the doctor's office, and that's not their fault. That's probably after waiting an hour in the waiting room. With us, you get an hour to 2 hours on the initial assessment so that you can learn about all the hormones, learn what you're deficient in. I've never seen someone come in 35, especially 40, and their hormone levels be normal. It just doesn't happen or optimal. So we're going to educate them. So the first step is lab work. Then takes about a week to get everything back. Then we go over that and we work on memberships. And so then they decide if they want to, join, get the medications, prescriptions or whatnot. And that's when our practices became so big that we opened a pharmacy because the pharmacy couldn't keep up with our members, which was a great problem to have.
Yeah.
So we're able to deliver straight to your door within 24 hours, all the prescriptions that you need. And then we see you at least every 3 months, if not more often. There's certain labs that we need to get every 30 to 60 days. And there's some that, for instance, vitamin D takes about 90 days for that level to come up. Never seen anyone that's not supplementing vitamin D that is in optimal range. Vitamin D helps pull calcium into the bones, helps with osteoporosis. Some studies show that it helps with weight loss. I know a lot of clients during COVID that were doing our programs that they got COVID with groups of people and they didn't get it as bad. And I do feel like it was because they were doing not just vitamin D, but I do feel like it's because they were healthier and doing the hormone program. So your original question was the first step, and that's lab work for sure. Second step is about a week later, spend an hour or two. And then honestly, we see you as often as you want. There's no time limit on when you can and can't come in.
Got it. Now, when it comes to common misconceptions, I know that the cancer one was kind of a common misconception that people had, but what are some other common misconceptions or myths that you hear from your patients, from your clients, as far as particularly with this type of treatment?
So unfortunately, one of the big ones back when we started in 2011 was heart attacks in men.
Hmm.
And there was commercials out there with lawyers all over saying, if you've had a heart attack and you take testosterone, it's because of the testosterone.
Hmm.
Well, guess what, Daniel? That study was flawed too. They were basically giving testosterone to 80-plus-year-old men, and they were out doing things that they should not be doing. And some of them were having heart attacks.
Mhm.
But JAMA, 2 years ago, I believe it was, don't quote me on that because I don't know for sure, they had to come out and reveal that the studies were in fact flawed. So if it's done the right way, then it actually prevents against those diseases. And
Mhm.
the studies out there back it up so much. I love the fact that it's all out there. I hate the fact though that it's too much out there because everybody's an expert now.
Yeah.
Everybody's diving into it. It's great because it does it, it kind of proves our point. Hey, we were right all along. I want to say we were right all along, but we've been doing it for 15 years. So my advice would be if you're going to go to anyone in the bioidentical hormone, go to someone that has experience
Mm.
because they're going to know what you need and what you don't need and what's safe and what isn't safe, excuse me.
Okay, so that's really good advice as far as if they're looking for somebody that really has that experience, that knowledge can really help them. Because it almost sounds like if it's done properly, this is like the fountain of youth. It's like it can make you
Yeah,
live
I mean,
longer,
it's,
have a better quality of
estrogen
life.
for women helps prevent wrinkles. I mean, yeah, it's like I said, we added aesthetics because it kind of goes hand in hand. You want to be healthy on the inside. Let's, feel pretty on the outside. But yeah, I mean, it is definitely can turn the clock back as far as how you feel, your sleep, your sex drive, your metabolism, skin dry. I mean, there's so many factors. Your hormones basically control everything in your body, and we can adjust that, according to your needs.
Okay. So on the flip side of that question, as far as how to find a provider, like what to look for, what are some of the red flags people should keep an eye out for? It's like, hey, if you see this red flag, you should maybe be a little bit careful about going with this provider.
I personally wouldn't go to anyone that uses anything synthetic. And I personally wouldn't go to anyone that isn't in the business, like I said, I wouldn't hire a plumber to fix my electric. So I wouldn't go to someone, and unfortunately they only get, like I said, 1 hour, if that, in med school. So they'll tell you, most of the ones that I've seen will tell you, I don't know, I don't understand. I think there are a lot of really good gynecologists out there that understand it, but that's because they've taken the time to learn. So I would ask a lot of questions as far as, what they're using, what optimal level is to them, how they're treating them, how much time do they have to spend with you. You really should have time with your healthcare provider, no matter what it is. I mean, I wish we could all get the kind of time that we spend with people, but unfortunately, a lot of places are insurance based, and that's just not possible. But just make sure they're answering all of your questions and maybe see up to 3 providers. When I'm looking for a healthcare provider, I generally try to see at least 3 and then kind of take my pick from there. So that would be my best advice.
Okay. That's great advice. Now,
Thank
Leesa,
you.
what do you think the future of wellness, I guess I'll call it, is going?
So hormones are great, and we're now getting into the peptides, which are
Mm.
similar to the hormones. It's a chain of amino acids, and I'm really just learning all this myself. But it's an addition to the bioidentical hormone, and I think that's where it's going. That, and of course, AI. I mean, that's a good
Mhm.
source as well. I mean, we're
Mhm.
all learning from that. Um, I'm not tech savvy, so I'm a little behind in that area, but I'm trying.
Mhm.
But I really do think peptides, along with the addition of hormones, is the future.
Okay. Now, peptides, I've heard the term peptides being thrown around. And hormones, I mean, I like that as hormones, and then like vitamin D, like that's a supplement. Is peptides more in the
Vitamin D is actually a
supplement?
supplement and a hormone. Sorry.
Oh, okay. I
Yeah.
didn't know that. Okay. Learn something new every day. So would
Yeah.
you say peptides is a little bit more a hormone or more of a supplement?
Um, right now it's not a prescription.
Okay.
So it's a good addition to hormones. So there's growth hormone, which we can test.
Mhm.
There are things for surgery, recovery. There's things for weight loss. Um, like I said, it's just a great addition. I don't want to dive too deep because
Mhm.
I don't like to speak upon things that I'm not
Yeah.
fully educated on,
Mhm.
and I'm just learning some of the or a lot of the peptides. But I do know that we are using them. Our doctors
Mhm.
are prescribing them, and they are having really, really good results with them. So I'm really
Mhm.
happy about
Okay.
that. And
Got
they've
it.
been used for a very, very long time. It's not something that just popped up. It's
Yeah.
something that has been used and studied. It's
Mhm.
just something that's becoming more popular.
Interesting. Good to know. Okay. So then now with your business, a new life, what's your vision for this business?
Oh gosh, I just love being a nurse. Like I said, the technology side is not my forte. I don't I even Zoom calls and all this is like I just want to be a nurse. I just want to. So I think that a lot of things will be going telehealth. I think that that's okay. I mean, people don't want to see us as often as we thought they did. We thought we were really popular until we started getting into telehealth.
Uh,
But my vision would be to just keep growing and to be able to be in multiple states. We're in 3 states now. We're getting ready to be in 30 states. We have another
wow.
physician coming on. So to be able to help people nationwide, even worldwide if possible,
Mhm.
with the laws, I'm not sure how that would work, but my vision would be able to help everybody. And for it to be, if, insurance could cover it, that would be great. I mean, we have to be careful because we wouldn't have the time to spend with our patients if, we were insurance based. So they can turn it into their insurance, but we can't guarantee that.
Wow.
So really the vision would be to be able to treat everyone in all 50 states, if not, globally.
Wow. It's a very big vision, but I think you've talked about it. I mean, if you can help so many people, then why not? Why not share with everybody?
I get really excited. People come up to me when on weekends or whatnot, and they'll ask me a question and I'll answer, and they're like, "Oh my gosh, I'm so sorry. It's the weekend and you're working." That's not work to me. I'm not going to come up to you and be like, "Hey, Daniel, did you hear about this new peptide or this new hormone on the weekend?" But if you come to me, you usually can't shut me up about it. So people can see my passion and feel my passion,
Yeah.
even if it's not in a medical setting. And I
Mhm.
love that because, I was overweight as a child. So we do offer weight loss.
Mhm.
Most people don't know that because I've been working out since I was 12. I have
Mhm.
a mother who died of ovarian cancer.
Wow.
So when we got the backlash that, oh, what you're doing causes cancer, it
Mhm.
really upset me. Like, I've
Mhm.
done my studies, I've done my homework, and I know it actually prevents. If you think for 1 second I would be involved in a business that I thought could cause cancer,
Mhm.
you'd better think again.
Yeah.
So I have to really educate people on synthetic versus bioidentical. And like I said, most people will see my passion. I'll talk to you all night long about it, even on the weekend,
Yeah.
but I won't disturb you on your weekend. Don't worry.
Yeah. Well, passion definitely shines through. Okay.
Thank
Well,
you.
Lisa, I have one last question for you, but before I ask it, I do want to point people to your website at A New Life, which is ENNULIFE.com. Now,
Correct. Anewlife.com. Yeah, it's ENNU, but it's pronounced anew.
Anu, yeah.
Anewlife.com.
So, last question then is what does beauty mean to you?
Beauty to me means what the person thinks it is. Like people think that beauty is one thing or another, and I see beauty as being what the person thinks. I want to have this type of hair, or I want to dress like this. It's I think it really comes from the inside. And when you look at someone else, I mean, not everyone's attracted to a 6 foot tall, or 6'4" tall, skinny man, or, short, muscular, or blonde hair, or dark hair. I mean, everybody has a different definition of beauty. So I think what beauty really means is what it means to you, if that makes sense.
That's a good way of putting it. It's a good way of putting it. So it really comes down to I guess, what you value and what you're looking for, and that's gonna be different for everybody.
Absolutely. Yeah. Because I mean, you never know what one man's trash is the other treasure. I mean, kind of the
Yeah.
same for beauty. I mean,
Mhm.
what you think is beautiful, I might not, and vice versa. So I think it comes from within.
Awesome. Well, there you have it. Lisa sharing her expertise. So, Lisa, where can people contact you in the business?
You can always go to our site, anewlife.com. We're located, like I said, in 3 states. We are starting to do telehealth. So the easiest way would just be get all kinds of information on anewlife.com. There's telephone numbers on there. There's different numbers depending on the state. And then watch out because we're going to be in a lot of states. And like I said, if my vision goes right, then we'll be at least all over the United States and hopefully even further. But I would suggest anewlife.com, and that's where you can get all the information that you need.
Awesome. Well, Lisa, this is amazing. You really shed a lot of light on hormone therapy, and it was great having you on and having you share your message.
Thank you, Daniel. I appreciate you having me.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.